I have been with Columbus Public Health for a month shy of 9 years. It's a great fit for me. I love serving the vulnerable populations and the underserved.
As we enter the building, everybody will get hand sanitizer.
I am a 26-year teacher here in Columbus Public Schools. I teach 8th grade, language arts, and social studies.
I'm a serial entrepreneur, as I've been called, but our newest baby is the Blue Note Jazz Cafe.
Futurity was started in 2014 here in Columbus, Ohio, and we really help organizations do two things. First, we help them analyze and visualize their data, and then from there, we use that data to help them communicate with their audiences in a one-on-one, highly impactful manner.
I've been working 15 years already, childcare home provider, and then I opened my center because that's what I like to do. I like to teach. We have like 30 kids that we serve in the center right now.
So the Refuge is a 13-month peer support recovery ministry, which means that our folks live with us. Anything and everything that causes an issue with somebody, we address in some way. Because we see this time as not just addressing someone's substance abuse issue, but it's the underlying issue that drove them to drugs.
You know, we had a couple soft openings at the end of 2019, but we were ready to go full throttle. January 2020, place was packed. We would turn people away because we couldn't fit them in here. And then March, COVID hit.
This disease has a high mortality rate. It is highly, highly contagious.
Like a lot of small businesses, on March 13th, our world kind of came crashing to an end.
Everybody was scared.
I have my own personal reasons for being scared, but then professionally, scared for our community.
We had to change how we do everything without changing what we do.
When they shut down schools, I said, this is serious.
The shutdowns are happening, our clients are calling us in a panic. We went, I think, about 21 days without getting a physical check.
When they sent me the grant, the city of Columbus helped me a lot. My employer, they need to, get paid. They gotta pay the house, rent, they gotta buy food. And what I did, I used that money for my employer and plus more things to clean.
The City of Columbus was sending emails out to us saying, here's a plan, here are resources for small business. We work with the Office of Diversity and Inclusion. They contacted us early on in the pandemic, letting us know about the PPP program. That allowed us to maintain our full staff, we maintained all our benefits, maintained all their salaries, and it really prevented us from having to make some pretty hard decisions here. Because of that support, not only did we weather the storm and not do layoffs, we ended up hiring, growing, and came into 2021 stronger than ever.
We have two sons that are 18 and 20 that were, assisted in the business. We had moved my parents in, as well as my younger sister who had cancer, into our home. And then when the COVID hit, first my younger sister, she got it. And then like a couple days later, we were like, we better all get tested. So the whole family tested positive. Unfortunately, my sister, who was 44 at the time, passed away. We have a very close family. And so, to try to handle that and then separate that and come in here, put on a happy face and figure out how we're gonna keep the business afloat has been a challenge.
March, April, and May of 2020 were incredibly difficult for us as an organization, just thinking through and asking questions and making sure we planned well so we could continue doing our mission. Columbus Public Health was a huge help in giving us guidance in what is a good way to keep our people safe. We're a congregate living setting, so we're around each other all the time, and it's figuring out how do we operate like a massive family. People were gonna die because of COVID, because COVID made people feel like they had to isolate. And in addiction, isolation is how people die.
It is important to remember that we are in the midst of a global pandemic, and COVID-19 has resulted in a public health crisis that has disproportionately negatively impacted minorities and people in communities of color.
Racism being a public health crisis, for me, it's about time. We've been talking about health inequities, health disparities, social determinants of health for years and years and years. And yet we continue to see these disparities in infant mortality, in HIV, in infectious disease, in heart disease.
Protesters are back in downtown Columbus for the third straight day.
Just thinking about how the protests, unfolded, the unrest. People are finally, getting fed up. We literally would saw them marching down Main Street, so we stood outside of our business. It's given us a broad opportunity to, discuss how we feel about it, what the outcomes are, and how it impacts, because we didn't have to board up our business, fortunately.
I am the mother of 2 brown children. I've adopted 2 of my boys. They're both brown. So personally, it was something to go through as a parent. I'm very proud of my multiracial family. So those things are really real for us. One of the things that has given me such great hope is the resiliency of the people around me that I work with.
I think we're already seeing Columbus start to have this comeback. We're seeing the vaccinations, rolling out in an efficient way.
I mean, you can see it behind me. They're out here vaccinating mass amounts of people every single day. We are going to be out of this someday.
It forced us to walk with a certain level of nervousness, but hopefully people will come back together and appreciate life.
I think they will learn love each other. Don't take life for granted.
I think this is an opportunity, and it should be a challenge, it should be difficult. There is such an excellent amount of loving, caring, kind people in this city that are incredibly smart. Columbus should be the example for the rest of the Midwest on what a city should look like. The space is here for us to have an incredible city and ask, what do we want Columbus to look like in 10 years? Not next year, in 10 years, and then make those choices.
I think Columbus citizens are resilient. We're tough. We have a lot of heart. It's that Midwestern work ethic that you hear so much about. It's the Columbus way, the idea that we're all supporting each other.
I'm excited to see what's next post-pandemic. We're going to keep on fighting.